Diabetes is a chronic metabolic disease characterized by high levels of glucose in the blood and is caused by the body's inability to produce or effectively use insulin, a protein hormone produced by the beta cells of the pancreas. The characteristic symptoms of diabetes can vary depending on the type and severity of hyperglycemia and often tend to appear at night. But what are they? Let's go and see them. The most frequently reported nighttime symptom in diabetic patients is nocturia, a condition that involves an urgent need to urinate, often more than once, leading to repeated awakenings. Those who suffer from it are forced to get out of bed, disrupting their sleep, with potential consequences for their health and quality of life. This happens because elevated blood sugar levels force the kidneys to work harder to filter out the excess glucose, thereby increasing urine production. Nocturia is often accompanied by polydipsia, a medical condition characterized by intense and persistent thirst that does not subside even after drinking. It occurs due to the excessive production of urine, which leads to significant fluid loss and thus to dehydration, a state of water deficiency in the body caused by a negative water balance, meaning that the amount of water taken in is less than what is lost. Another symptom of diabetes can be excessive sweating during the night, especially in people who already take insulin or certain diabetes medications. When blood glucose levels drop too low, the body reacts by triggering an emergency response via the sympathetic nervous system. This leads to the release of hormones like adrenaline and noradrenaline, which stimulate the sweat glands, causing intense sweating, as well as tremors and palpitations. Waking up in the morning with a headache or a feeling of fatigue is one of the most common symptoms associated with various conditions, including diabetes. Fluctuations in blood glucose levels cause a series of hormonal changes that can lead to cerebral vasoconstriction, or the narrowing of blood vessels in the brain, contributing to headaches. Morning fatigue, on the other hand, may be linked to poor sleep quality, disrupted by frequent nighttime awakenings due to nocturia or excessive sweating, as well as to high levels of glucose in the body. In this state, cells are unable to use the sugar properly and therefore do not receive the energy needed to perform their normal functions. The brain, which relies mainly on glucose to function, is particularly affected, making it harder to concentrate and reducing the ability to carry out daily activities such as working, studying, or doing any kind of physical activity. Another typical nighttime symptom of diabetes, though usually present in more advanced stages, is nighttime cramps. These are involuntary and sudden muscle contractions that often occur during sleep and tend to affect the calves, thighs, and feet. These cramps are due to what is known as diabetic neuropathy, a condition, or rather a complication of diabetes, that results from damage to the peripheral nerves caused by long-term elevated blood glucose levels. Pain, numbness, and sensory and motor deficits are among the main symptoms of diabetic neuropathy. In conclusion, diabetes is a chronic metabolic disease that, if not diagnosed in time and kept under control, can lead to a range of health consequences, some of which may be serious. Recognizing the symptoms early allows for timely intervention, better glucose management, and a reduced risk of long-term complications.